Swadika Wanasan Kerhongs, and welcome to Be My Guest, the program that brings you successful stories of institutions and entrepreneurs in both domestic and international arena. Today, in remembrance of His Majesty the late King Bhumibol Adulyadej, we will learn more about His Majesty the King's guidance for the Institute of Dermatology and how did it transform into many successful projects. Today we are honored to have Dr. Jinda Rojanametin, the Deputy Director of the Institute of the Dermatology, here with us. สวัสดีค่ะ
สวัสดีครับ
สวัสดีค่ะ Dr. Jinda. Now, of course, you are the Deputy Director, obviously, of the Institute. I'm just wondering if you can give us a little bit of a background of the Institute. When we talk about dermatology, we don't hear that much, obviously. This type of disease that is not that commonly known. Could you give us a little bit of background on the Institute itself?
Okay. Actually, the Institute of Dermatology is the hospital from the Ministry of the Public Health. And we are in the Medical Services Department. Our hospital located in the Bangkok. Actually, the mission of our hospital is the first one is to take care the skin problem of the Thai people around the country. And the second one, since we are the institute, we need to contribute, transfer the knowledge, not only for the doctor who would like to train the skin disease, but also for the medical personality like the nurse, like the technician, to help the diagnose and treat the skin problem. And including we need to do the research, especially for the treatment of the common skin disease, including the new skin, to improve the skin health, skin problem of Thai people. Our hospital has been established more than 40 years.
Wow.
I think 43 years.
Okay.
Yes. So this is the main mission of the hospital.
Now, when we talk about the skin disease, though, we don't hear it that much. What are, apart from providing the services to people in a rural country and also inside the Bangkok itself, what else are you trying to do? What are your roles? Like, what are your goals and such?
We provide the care for the skin problem. As I mentioned earlier, not only for the people in Bangkok, but we need to take care the skin problem of the people in the rural area.
Are there a lot of lab and research and such done as well?
I think we need to say that we go together. Such as when we take care the skin problem and we found something new disease or new technology. So this may be the point that bring us to do the further research on this field.
How many hospitals that actually have this type of I guess the department that deal directly or specifically with the skin problem?
I think not so many because
why is that?
Because in general skin problem seems to be like the minor disease because the patient who face this problem normally may be like the not such a life-threatening disease. So for the skin department seems to be quite small. However, in fact, for the skin problem in Thailand, I think this is a major problem.
Okay.
According to the statistic record from the Ministry of the Public Health, the number of the skin patients is number 7 among
Number
all
7.
disease. Yes.
How many diseases are we talking about here? I'm pretty sure it's more than hundreds.
Such as like the heart problem, lungs problem, neurological problem.
And this is number 7.
Yes, yes.
But is that kind of, it doesn't make sense. Why do they not have that very many specialized or specialists, if I might say?
Because among all skin patients, the number who suffer from the very severe disease is quite very small in number. So in general, they estimate like the skin disease is not the major one. It's not the major one. I mean that the volume is very high, but the risk of the disease is quite small compared to other diseases.
Okay. But when we talk about the skin disease and such, I guess because like you say, it's not life-threatening. For example, for myself, sometimes if I have a little rash or whatever, what would you suggest like people would do? Because sometimes people treat it like, I'll just put something on and it's fine. Is that a good way to go, or?
Yes, this is common problem in our real life because it seems to be like the minor problem. So sometimes the patients may try to treat themselves that may be in the wrong way, and followed by the complication or the side effect of the treatment, especially in the rural area, because according to the information nowadays, we have not so many dermatologists. In our record, we have almost 600 dermatologists in Thailand, but more than 70% stay in Bangkok or in the big city. So the problem in the rural area, they may have the insufficient of this personnel.
Now, because I mean, obviously, this is in remembrance of His Majesty the King, who passed away as well. Is there anything that the Institute have done or is planning to do in order to honor his teaching?
Yes. According to the problem that we mentioned earlier, so the Institute of Dermatology also concerned about the people in the rural area who suffer from the skin disease. So in 2015, we joined with the Dermatological Society of Thailand to establish the mobile medical service into the rural area. And at that time, we joined with the Thai Medical Council, that may be the very big team. At that time, for the full team, we have the highest number of the specialists, of the physician who join together into the rural area and do the medical service. At that time, I can remember that they have this record in the Guinness Book as the highest number of the specialists, of the physician who join the mobile medical services.
And this is when how many provinces does this cover? Do you remember how many provinces?
At the time, I think about 4 provinces. For this activity, at that time, we do like in honor to Her Majesty, the King and the Queen.
I see.
Yes.
So at the time, that was, I think, 2 years ago, if I remember correctly, or 3, maybe, perhaps 3 years ago,
yes,
right? 2013. 3 years ago.
Oh, sorry, 13,
right.
yes.
Okay, so in this remembrance, have you seen any, like, you have joined, right?
Yes.
You joined that particular event as well. What do you feel while you were there? Like, do you feel like this is something that, something that you would like to follow even more, or do people around there get motivated as well?
Yes. Actually, we have no imagine before we joined at that time, but when we were in that situation, we can recognize that the people in the rural area were very happy. They have a chance to see the specialist to treat their own problem. correctly. So they were very happy, and they also asked us that when will you come back again and next year, something like this. So this may be like the motivation for myself and my hospital, including the society, to continue the mobile medical services, even though we may develop it by ourselves.
So that's like a starting point,
Yes.
almost like the motivational point where you realize that once you're in the field, that's how you get a chance to actually talk to people. And I
Yes.
believe that His Majesty the King has been trying to do like all his life as well, right? Now, apart from that, you just said that, after that, maybe the year after, years later, this particular project still continue on?
Yes, of course. Last year,
Okay.
Regarding our motivation, including the policy from the government, we plan to extend our services and the care to the more on the rural area.
Okay, so more than just the 4 provinces
Yes.
that you have done.
Yes.
Are these going to be like the annual thing that you will be doing?
We start this project last year by our hospital, Institute of Dermatology. We plan to provide this special care for another 4 provinces. Because when we touch to the situation at that time, we realized that for the rural area they have 2 major problems. The first one is about some common skin disease. Actually, they can treat quite easy at the rural area, but the problem, they have no medical personnel. They are shortage about the medicine. And the second one, some patients suffer from the severe skin disease. So we have the 2 major groups, and then we try to correct these 2 problems.
And obviously, if it's annual thing, I'm pretty sure that continuously it will improve. You will actually see the result.
Yes,
Right.
we try to implement our support, and then we try to evaluate the result on each year.
Okay, this is such a great project. Now, because that's all the time we have for the first break, but for the next break, obviously I'm going to ask you a lot more about a lot more project of the Institute. So make sure you stay tuned because we have a lot more interesting project.